When we think about strokes, we usually picture a simple plumbing problem, right? A blocked pipe that cuts off oxygen to the brain. But what if I told you that initial blood clot is really just the opening shot in a much bigger, hidden war?
Welcome to this explainer. Today we are diving straight into something absolutely fascinating: how a stroke physically tears down the blood-brain barrier. Think of the brain as a highly protected fortress under siege. When a stroke hits, it's not just the neurons that are taking the hit. The very walls protecting them get compromised, and that kicks off a crazy chain reaction that turns a localized brain injury into a full-blown, body-wide immune crisis.
So, here's how we're going to break this down today. We'll start with the protective brain fortress, check out the ischemic trigger, and then see what happens when we breach the barrier and the floodgates open. After that, we'll get into the systemic immune war, and finally wrap things up with the neurovascular unit. All right, let's get right into it.
Section 1. The Protective Brain Fortress.
Okay, so before we can truly grasp the damage a stroke causes, we really need to understand the normal, healthy state of this fortress. The cellular architecture of the blood-brain barrier, or the BBB, is honestly pretty incredible. You've got these endothelial cells lining the blood vessels, and they are basically bolted together by what are called tight junctions. Normally, this whole structure acts like the world's strictest VIP bouncer. It tightly controls what gets into the brain and what stays out, keeping random toxins and roaming immune cells safely in the bloodstream, far away from our delicate neural control center. It's a very peaceful, highly regulated environment. Moving on to Section 2, the ischemic trigger. So, what actually happens when that piece is violently shattered by a blocked artery? Well, blood flow just drops off a cliff, and that creates two distinct zones in the brain almost immediately. In the center, you have the ischemic core. That's where severe ischemia drops blood flow below 10 to 25%, meaning rapid, irreversible cell death within minutes to hours. But surrounding that core is the ischemic penumbra. Now, these neurons are struggling. They're partially perfused and functionally compromised, but crucially, they are salvageable if we can restore blood flow. But here's the catch. Saving them isn't just about turning the tap back on. They have to survive the incredibly toxic environment that comes next. Because almost instantly, this brutal chemical cascade kicks off, threatening that entire salvageable penumbra. First, you get massive energy failure because there's suddenly no oxygen and no glucose. That severe deficit triggers a massive ionic imbalance inside the cells, which sparks the formation of reactive oxygen species, or ROS. These free radicals are just incredibly destructive. They combine with this intense wave of inflammation to activate specific destructive enzymes like MMP9, and that is exactly what leads to the physical breakdown of the blood-brain barrier. Which brings us to Section 3, breaching the barrier. Let's actually zoom in on that microscopic culprit I just mentioned, matrix metalloproteinase 9, or MMP9. You can really just think of MMP9 as a microscopic battering ram. Once it's activated by all that ischemic chaos, this enzyme literally digests the structural matrix of the blood-brain barrier. It chews right through the basal lamina and those tight junctions we talked about earlier. The physical integrity of the fortress? It's officially breached.
Section 4. The Floodgates Open.
Once those walls are down, the consequences for the brain are immediate and, frankly, terrifying. Minutes after the initial ischemia starts, the structural danger's already underway, but it really peaks between 24 and 48 hours. Because the barrier's now leaking, fluid literally rushes from the blood vessels directly into the brain tissue. This causes massive swelling, known as vasogenic edema. And remember, your skull is a rigid, closed box. It doesn't stretch. So all this swelling creates a deadly mass effect, physically pushing the brain off-center. We call that midline shift, and it can be lethal. Plus, over the next few days, having this weakened, leaky barrier significantly increases the risk of hemorrhagic transformation, which is when actual active bleeding starts pouring directly into the already damaged brain area. So what does this actually mean for a patient? Well, the medical reality is stark. Blood-brain barrier breakdown is directly associated with much poorer clinical outcomes because it heavily exacerbates the initial brain injury. The leak itself isn't just an interesting little side effect, it's a primary driver of the devastation. Stopping this swelling and sealing that barrier is quite literally a life or death priority in acute stroke care. And that leads us to Section 5, a systemic immune war. Here is where the story gets really wild, because a broken barrier doesn't just let things into the brain, it lets things out. And that rapidly turns a localized brain injury into a whole body crisis.
In a healthy state, the BBB is a strict selective filter. But once it's breached, it turns into a completely chaotic two-way street. On one hand, you've got peripheral immune cells, like leukocytes, infiltrating the delicate brain tissue and just throwing fuel on the inflammatory fire. But on the flip side, you have brain-specific molecules and antigens escaping out into the systemic circulation. And these are things that are absolutely never supposed to leave the brain.
Some of the absolute worst offenders leaking out are called DAMPs, danger-associated molecular patterns. A major one you'll see in the research is HMGB1. You can think of DAMPs as chemical distress flares. When neurons start dying off in that ischemic core, they release these DAMPs. And because the fortress walls are down, these blaring chemical alarms leak out of the brain into the spinal fluid and eventually crash right into the body's main bloodstream. When those distress alarms hit the bloodstream, the body's entire immune system basically loses its mind. It triggers systemic inflammatory response syndrome, or SARS, literally within hours of the stroke. The lymphoid organs mount this massive, aggressive response. We see inflammatory cytokines like TNF and IL-6 just skyrocket in the blood. But here's the really dangerous twist. This massive early immune explosion is almost immediately followed by a state of severe systemic immunosuppression. The immune system essentially exhausts itself, and that is critical because it leaves the stroke patient incredibly vulnerable to post-stroke infections. Things like pneumonia become a huge, very common complication, especially if the stroke has impaired the patient's ability to swallow.
Finally, Section 6, the neurovascular unit.
Okay, knowing everything we now know about this completely wild chemical cascade, where does stroke treatment go from here? The answer relies on a relatively new concept, the neurovascular unit. For the longest time, medicine basically obsessed over just trying to save the neuron itself. But actually, scratch that. Researchers now realize you absolutely cannot just save a neuron in a vacuum. The brain is a deeply interconnected ecosystem. It's neurons, glial cells like astrocytes, and vascular cells like the ones making up the blood-brain barrier, all communicating constantly. Dysfunctional signaling between all these players is what truly drives the injury. So, to ensure actual survival and recovery, future therapies have to protect the structural integrity of the entire neurovascular unit, not just the individual pieces. Which leaves us with one pretty mind-blowing question to chew on. If the real devastation of a stroke isn't just about that initial lack of oxygen, but rather a whole-body immune war triggered by a broken barrier, could sealing those fortress walls be the ultimate key to future therapies? Imagine a treatment that rapidly blocks MMP9, repairs those tight junctions, and stops the leak before those chemical alarms can ever trigger the systemic immune system. It's a profound shift in how we view brain injury, and it really highlights just how incredibly interconnected our bodies are. Thank you so much for joining me on this explainer today. I really hope this helped you build a much deeper, clearer picture of the hidden science behind strokes.